Medical imaging is the visualization of tissues, organs, and biological processes within the human body. It will change the face of medical sciences forever. The VU University Medical Center has the opportunity to host a state-of-the-art imaging facility in Amsterdam. Through this new imaging center, we will enter a new era in patient care, research, and education. Imaging will greatly impact early diagnosis and guidance of therapy.
So now we just entered one of the radiology rooms where we perform diagnostic X-rays. This is one of the oldest imaging techniques, but it's still used very widely. So you can make simple X-rays. So these are two-dimensional pictures, for example, to look at fractures. But in fact, a CT scan is also based on X-rays, but now you're lying in the tube and the X-ray is circling around you and taking many small pictures and then calculates an image, which is then a cross-sectional image. And then you can slice through the whole body. But the fundamental contrast is still X-ray.
Medical imaging helps clinicians to locate and diagnose a disease at an early stage. Imaging can also help us to select the right treatment, monitor its effectiveness, and follow the distribution of medicines throughout the body. Giving each patient optimal, personalized treatment is now within reach.
Well, roughly speaking, there are three areas of imaging: radiological imaging, nuclear medicine, and optical imaging. Optical imaging uses very high frequency laser type of light and has a very low penetration, so you can only look at superficial pathology. Nuclear medicine uses radioactive tracers, the advantage of which is that you can look at things at a very low concentration, like receptors or something. Whereas radiology is a bucket full of techniques, encompassing ultrasound, CAT scan, magnetic resonance, and a couple of other modalities.
Nuclear medicine includes techniques such as PET and SPECT scanning, and display remarkable detail in the body's biological functions. Developing tracers is an important element to visualize and locate these complex processes in the human body and to understand the efficacy of drugs.
Imaging is a very useful tool to develop new drugs and to evaluate a response to drugs. For example, we have radio-labeled anti-cancer drug called docetaxel, and with that radio-labeled anti-cancer drug we were able to follow the drug in the body, and we were able to measure the uptake of the chemotherapy in tumors. And ideally, we would like to predict which patients will benefit from a treatment and which patient will not benefit from a treatment. And for that purpose, radio-labeled anti-cancer drugs, for example, or other radio-labeled drugs may help us to select patients for a specific treatment.
Tracers are radioactively labeled chemical compounds that can be traced within the human body with a PET scanner. The VU University Medical Center is a world expert in the field and has Europe's largest laboratories for developing and producing tracers for clinical use.
Here we are preparing the patients for the PET scan. The PET scan is in the other room, and the patient will get a catheter, this one, and through this line the PET tracer will be administered during the PET scan.
With the introduction of hybrid scanners, radiology and nuclear medicine come together.
Before we had this PET-CT scanner, we could only scan the PET image. So it was kind of tricky for us as nuclear medicine physicians, because we had the CT scan on one hand and we had the PET scan over there, and at times it could be quite difficult you had to fuse them in your mind, so to say. You couldn't directly overlay them. That was quite difficult. As an example, I have here images of a patient with lymphoma, so that's lymph node cancer. This is the CT component. This tells you whether there is anatomical abnormalities, enlarged lymph nodes or any other kind of abnormality of shape and size. So what the PET information adds to this, and those are the colored images here, is whether abnormalities seen on the CT scan are represent disease or not. So we can fuse the image, so put them side by side as an overlay. Here we are looking at the liver, here's the spleen, and here's something we can't tell from the CT what it is. Now we add the PET information and we see that this is diseased, all of this is diseased, so inside the spleen, inside the liver, and this is that was abnormal at the CT is normal at the PET scan.
Optical imaging techniques display real-time structural and functional information of hollow organs at a cellular level. This brand new technique makes use of a very high-frequency laser and is currently implemented in the clinic.
So we're here in one of the optical labs of Laser Lab. Here we develop new optical techniques for medical imaging in the hospital. So what I'm going to show you today is a little bit of OCT. That's an imaging technique where you can image into tissue up to a depth of about 2 millimeters. And the advantage of this technique is that it has a much higher resolution than what is currently available in the hospitals. The real hard part of this technique is what we see here. This is an endoscope. We need it to be very small to reach the very small areas of the lung. So the lung starts pretty large, about this size, but it comes down to the size of less than 1 millimeter. So with this one we can't even reach the furthest areas of the lung, but we can reach about 90% of it. And this is what you want to use to look for abnormalities, for instance lung cancer. This is actually what the endoscopist holds. It has a movable tip. You can go into the lung, steer it to the right location. You see, you can steer this tip here. And then finally that thing comes out and we can image the tissue. And here I have a video of the lung. So what you can see here is the catheter sheet, that's the protective material that is sterilized. And then you can see here the walls of the lung. And this is a resolution that you can absolutely not reach with something like a CT or MRI. We can see, for instance, the cartilage rings here. Here are these white areas. Here you see a cartilage ring. But the thing that's of real interest is the epithelial layer there and the darker layer there and what's beneath that. And that is where tumors develop. So by going with this technique into the human body, we can look for these abnormal areas and see if we can find tumors.
As optical imaging techniques take a big step forward, so do nuclear medicine and radiology in merging their techniques. PET-CT is well known. PET-MRI is new and only available in a handful of hospitals around the world. The VU University Medical Center is now building the first PET-MRI center in the Netherlands.
Actually, PET-MRI is a new machine, and there was already a PET scanner, there was already an MRI, but this is a hybrid aperture. We think that the results with this machine is more than 1-to-1. And we have high expectations for the clinical benefit of patients that this machine will have added value. And in this field we want to be international frontrunner. So we are the first center in the Netherlands which has such a machine and one of the few within Europe that has such a machine. And we think we shouldn't wait till the imaging center is there, and therefore we immediately started that PET-MRI center.
The VU University Medical Center is heading for the next step. In 2016, the doors to a fully integrated and state-of-the-art imaging facility will open. The VU University Medical Imaging Center. This center will become an innovation hub in which imaging specialists, pharmaceutical and scanner industries and patient groups will join each other.
Special about that, you saw a lot of the imaging infrastructure and a lot of the key opinion leaders here at our campus, scattered throughout the whole campus. And we want to bring all this expertise together in the center. Within the Netherlands, of course, We are very centralized in Amsterdam, but also internationally. It's not only that we serve the Netherlands, this is international, and the fact that we are near to Schiphol makes us a very attractive partner.
Medical imaging will lead to an overall better understanding of the complex structures and functions within the human body. The Imaging Center will host a multidisciplinary team of specialists. It will lead to better and more cost-effective patient care embedded in a healing environment setting. It will speed up the development of new imaging techniques, new drugs, tracers, and scanners. And it will result in a highly attractive international teaching environment where the imaging specialist of the future will be trained.
And that implies that you are moving away from just being a doctor, diagnosing patients and throwing reports over the hedge, into getting into a closer contact with the guys who are treating these patients, and together, in a, again, multidisciplinary setting, define what the best treatment for individual patients could be.
We need specific techniques, for example PET scans, radio-labeled drugs, to identify which drugs will be most successful in the clinic.
It's for each academic center, it's very important to innovate. That's the part of the function. Make healthcare of the future better than healthcare of today.
I think that we will educate the next generation of physicists and clinicians actually that need to work with these new technologies.
We are proud that we can play a leading role in healthcare for the coming era. The imaging specialists of tomorrow will create new therapies and develop personalized medicine. The new Imaging Center gives us the chance to be good at what we do. We see a bright future.